your Houston chiropractor, Dr. Gregory Johnson, and today we have the pleasure of having the star cornerback for the Houston Texans in here, Kareem Jackson, who just signed a huge 4-year deal on Saturday. Congratulations.
Thank you. Thank you.
Yeah. Texans are looking good here coming up, aren't they?
Definitely.
Yeah, and Kareem's a big part of that, and we're happy to have him in here. We're just helping him increase his function and performance because he really doesn't have a lot of problems, so we're just going to help him at his peak performance so they can go to the Super Bowl next 2 years. Okay, let's flex you forward and then backwards. We check his posture just like we do everyone. Now his posture has gotten tremendously better when it wasn't even that bad to start with. He got just a little translation to the right, but everything else is a lot better now, including the pelvis. But I'll show you how we do some sports chiropractic today with Kareem. So let's go ahead and decompress you first, Kareem. There we go. Yeah, that's good. Perfect. Yep. Get this one on your side, too. So, yeah, just that right there. Okay, good. We got that gonna make me some new ones of those. It should be better. Take a deep breath through your nose. That's all in. Excellent. Feel that all the way down?
Yep.
Good. There we go. As you know, playing football, whether it's Pop Warner or in the NFL, is like being in a car accident every time you go out there. So, Kareem's smart, just like a lot of the other big name star NFL people like Joe Montana, Roger Craig, Jerry Rice, Emmitt Smith, Moose Johnston, bunch of the Cowboys, Jack Del Rio. Everybody who wants to be at their peak performance, like Tom Brady, Aaron Rodgers. In fact, Aaron Rodgers' dad is a chiropractor. Legs are exactly even, so see his balance down his pelvis and low back are good. That didn't hurt too much, did it? Tightened up just a little bit right here at his lumbosacral region. So I'm adjusting his sacrum first on the left and then right. His right SI joint. And the left SI joint. Now I don't do a side posture on him or a lot of our patients because that can create some ligaments instability, and the last thing that Kareem would need for his low back and pelvis to be unstable out on the field. So we do things to tighten up the ligaments, and then the bones hold in place a lot better that way. Yeah, put your head full forward there. There we go. Okay. There. Okay. One more right here, Kareem. There we go. Good. Now he's been working out here recently and a little bit just sore from starting working out again, so I'm not going to do the turbinator on him today. You don't want to do that on somebody that's really sore from workout type stuff immediately. Just work this vibration deep down in the tissues and get the blood flowing into the muscles and ligaments and carrying out the metabolic waste products of normal cellular metabolism. And that helps. But most all athletes, amateur or professional, has tight IT bands, or what people call IT bands, on the side of the thigh. It's really the tensor fascia lata muscle that we get in there deep on those. Now I'm going to get into his what I call the pocket down at L4, L5, right where the quadratus lumborum, multifidus, and erector spinae muscles from the lumbar spine connect right into the sacrum and SI joints. And you just put some deep, steady pressure in there as they're breathing. And then We work all the way up into the thoracolumbar spine, around T11, T12, L1 right here. And those are always a little more tender, huh? Yeah. Oh, there. You can see I kind of bounced off that one because it's got a little bit of a tautness to the muscle, so it's hard to stay on those sometimes. That's why you start off light and then just keep increasing the pressure as they exhale. Now Kareem also has his own, besides being a professional cornerback, he's got his own clothing line out now, and I'll let him talk about that after we get done. It's called Fly Guy, isn't it? Mm-hmm. Yeah. And that's already big here in Houston, but he's going to be making it for commercial use out into the retail stores around the country in the near future, aren't you? So I'll let him tell you more about that. He knows a lot more about that than I do. It's his thing. Yeah, we're happy for the Kareem and his family, first of all, but happy for the entire Texas organization, because I think they're putting together a really good team of core people that they can continue to build around and have leadership in. Ooh, that one's a little tight right there. You feel that in the piriformis right there? So this bottom muscle goes from the hip joint to the sacrum, which is called the piriformis. So we get pretty deep on that one. Release those trigger points. There we go. Good. Okay, let's turn you on your back now. So Kareem does a lot of fast cuts and turns and rotations, so we adjust his knees just to make sure they're strong and stable, and tighten up the medial and lateral collateral ligaments. And he's got good strong ones. Now I've got another one here. There we go, better. Did you feel that one a little more? Good. Good. And then on him, we work on his anterior hip flexors here, the psoas muscle. And you isolate that muscle by bringing the leg up and flaring the foot out. Okay, I'm going to push it down, hold up. See, he's excellent in strength, but we're going to do an active resistive exercise and putting right into the belly of the muscle. That's not as sore as it was the other day, huh? Not. That's excellent. And then we apply some stress to the medial and lateral collateral ligaments through working the sartorius muscle. Okay, go ahead and hold that. And again, we're just pulling while he's resisting. And that increases the stress on the medial and lateral collateral ligament. It's Davis's law. Good deal. One more time. He's so strong you can't even break that. Okay, so let's just see how strong they are over here. Yeah, see his right one's always been in pretty good shape. Yeah, oh, I felt that pop. Did you feel that? Mm-hmm. That was good. One more. Yeah, good job. Okay. And again, just to strengthen up his ligaments and tissues, we're going to pull out on the sartorius. This is a way you can tell if somebody's got sacroiliac problems or knee problems. They'll be weak in the sartorius, and he's anything but weak. Yeah. Makes me break a sweat. Alright, and then he's really a lot more limber than most, but we stretch out the hamstrings by bringing them to tension. Okay, go ahead. And then have him push while I'm holding it. Okay, relax and breathe in. And you just keep increasing that. There we go. One more. Okay. You're excellent. Well, look, he's about 120 degrees on that one. Well past 90 degrees, which is where most people have a problem. Okay, there you Excellent. Okay, let me help you up here, my friend. Yeah, Kareem was up for free agent this year, so they locked you down before that even got started, huh? That's great. And again,